Hello. I want to make sure that everybody can hear me. This a new microphone and everything. And I didn't get a chance to try it out. We just actually finished our procedures for the morning and early afternoon. Okay. So I'm Dr. Robert Groysman with Southwest Pain Management, and we treat long COVID, including parosmia, anosmia, taste dysfunction, as well as brain fog and fatigue and heart issues that are associated with long COVID. So no questions yet. So um, let's talk about a question that I've been seeing um, in several of the groups, and that's the going back and forth of symptoms. That is, symptoms get better and symptoms get worse, and what's that all about? Well, one of the first things that you can see with this is that it's no longer stuck. So that your autonomic nervous system may still be unstable, but it's no longer stuck in the on position, which is a good thing. So doing something as simple as the TENS unit, for instance, can help bring that back to normal. Well, I was kind of hoping to get some questions coming in. Okay, Diane. Okay, she's asking something about creating a channel to ask questions. So I haven't really tried this out on YouTube yet, but I'm assuming, hold on, let me see here. Okay. Okay, hopefully this will work. I apologize. This is my first time doing this. So hopefully now it's going to work. So while I wait for the first question, we can certainly talk about stellate ganglion block and kind of what it does and how it works. We do the C6 and the C4 blockade or sympathetic blockade. And at C6, it's done at C6 because the stellate ganglion lives slightly lower at C7 to T1, but it's dangerous to do it at C7 or T1 because there's also the top of the lung that's present, and we go to C6, and hopefully the medication will travel inferiorly towards the stellate ganglion. So the part of, at C4 is the superior cervical ganglion, that were cervical plexus that we're after. So essentially, you're getting it at two different spots. Okay, we have our first question from Hope and Jason. What if symptoms got progressively worse after recovery, after the initial infection? And if it's more dysautonomia type symptoms, yes, it's still considered long COVID. Long COVID actually causes dysautonomia, and dysautonomia can cause long COVID. It's kind of like the chicken and egg problem. You don't know what came first. Although people who have dysautonomia or have had a prior insult to their sympathetic or actually I should say the autonomic nervous system are more prone to developing long COVID. So things like Epstein-Barr virus or mononucleosis, which kid hasn't had that in high school or junior high school? And diabetes type 1 and 2 can also injure the autonomic nervous system. And rheumatoid arthritis, lupus, there's many conditions that can potentially injure the autonomic nervous system. And that can lead to dysautonomia and this whole long COVID thing. I hope that answers your question, Hope and Jason. I wanted to make sure you guys can hear me, because there's no way for me to check if my voice is coming through. I was kind of hoping for a little bit more involvement or questions coming through. If we don't get too much interest, I will probably end it early. Diane, is there any question that you have? Okay, hold on here. There's more questions. Okay, I see that. Okay. Okay, so Alicia asks about not being able to taste or smell, and that's very common. We call that anosmia. And Aguesia, I can never pronounce it properly. I just say loss of taste. And she feels that some things, she could smell some things, but not others. So it's not really, it's not totally obvious why you can smell some things and not others. It either falls into the hyposmia category, which would be just reduced smell. You can still smell everything, but it's just at a kind of a reduced volume. Or it could be anosmia where you're not smelling anything. I don't know if there's definitely a separation. It's more like on a curve. And there's no specific reason why that happens. So Holly is asking more about what the SGB is or how it's done. So myself in particular, I use ropivacaine 0.5%. I do that because it's safer than bupivacaine. They're both related. Ropivacaine is just one portion of bupivacaine. So what this local anesthetic does is it essentially stops the conduction of the neural transmission through the sympathetic. So it's not just stopping things from coming into the stellate ganglion, but it's also stopping impulses from going out. So I use ropivacaine because it is safer. It is less cardiotoxic. It's less neurotoxic than bupivacaine. I hope that answers your question. I guess Premier Video is asking about, is this olfactory nerve damage? So yes, originally when you have COVID, there is olfactory bulb damage, or the epithelium of the olfactory bulb is damaged. But luckily, our olfactory system has the fastest regeneration of any nerve in the body. And within a couple of weeks, that epithelium regrows and everything is pretty much back to normal. But just because it looks normal doesn't mean it functions normally. And so that's essentially the explanation for that. And I guess Premiere Video also wants to know about if it's stuck in hyperdrive, so to speak. The SNS is stuck. So yes, it is. The sympathetic nervous system is stuck in hyperdrive, or pedal down, as I call it. It wants to go forward. It's not normal. Our sympathetic nervous system is supposed to be kind of on reserve when we need a bodyguard, so to speak. When there's trouble, or when you have to fight or run, when there's a stressful situation, that's when it's needed. It's not needed most of the time. Okay, so Diane asks about anosmia, and it switches to parosmia. So yes, that's a very common pattern. Some people don't even recognize that it shifts from anosmia to parosmia. Some people just start off in parosmia from the get-go. So think of it kind of like a switch. From the initial damage, it just completely shut off, and it tries to boot itself back up. But what happens is it's like a brownout. And if you had an old TV, 15, 20 years ago, the old CRT TVs, when there was a brownout, or any appliance, when the power just cycles, that's essentially what your olfactory system is doing, and your taste as well. So it was powered on, but it was powered on at kind of half power, and it doesn't work right. So you have to shut it back down and turn it back on, just like you would any appliance. Let's see. So Holly is asking, does the injection go into just nerve cells at C6? No. So the reason we put it at C6 is because it's safer than putting it at C7 or T1, which is where the stellate ganglion would normally be in about 80% of people. It is a collection of plexuses that come together to form a ganglia, which is just a collection of nerves or nerve fibers. We put it at C6 to hopefully spread down to the stellate ganglion, but we also put it into C4, which is part of the superior cervical plexus. So we're kind of hitting it at two different points, one at C6 and one at C4. Jane is asking if 2 shots can be done in one day. And I guess one of her local doctors does them 2 weeks apart. So there's no harm in doing it in one day, as long as your physician is comfortable with it. The reason that many aren't is because one of the side effects of doing a stellate ganglion block, whether it's at C6 and C4 or just at C6, is the numbing of the recurrent laryngeal nerve. Now, this nerve goes to the vocal cords, and you have two, one on each side. And if you block one side, you just get a hoarseness and a lump in your throat, and maybe loss of voice. But if you block both of them at the same time, or they're both blocked, your vocal cords both close, and that creates a medical emergency, because now no air can pass essentially from your lungs, from your nose or mouth into your lungs, and vice versa. So that creates a surgical or medical emergency. So many doctors don't want to take the chance of blocking both sides in the same day. However, if essentially the time course of how the block works, you can do them as long as you know what local anesthetic you're using, and you can technically do them the same day, and we do the same day many times. Luke is asking about the TENS unit, and about anxiety, tinnitus, or sound sensitivity. So anxiety typically becomes less. So when your parasympathetic is stimulated, your vagus, the majority of people feel very relaxed. Many doze off or feel sleepy and just go to sleep. which is what the parasympathetic is supposed to do. It's supposed to relax you, time to rest and heal and digest. That's what it does. Tinnitus usually becomes better. In fact, there's several studies showing that TENS can be used to stimulate the vagus nerve for tinnitus. As far as sound sensitivity, I'm not sure if it would have any effect, make it worse or make it better. I hope that helps. LNS is asking a question. Let's see here. So asking why the smell and taste were normal or returned to normal, and then parosmia started. And there's some confusion about this. So I guess the easiest way to answer this is, again, going back to the brownout situation. And when the sympathetic system and the autonomic nervous system and the parasympathetic system, when it's long COVID makes it really unstable and fragile, and it can kind of sway one way or the other. And you may have periods of normal taste and smell, but because the sympathetic is overdriven, it forces regional blood flow in the face and head and brain, and essentially, the organs responsible for taste and smell to be altered. And that alteration can cause problems with taste and smell. I hope that helps. Okay. I guess Mr. Bracken is asking about SGB. So we, I guess the stellate ganglion is not readily available in the United Kingdom. I mean, really, the only option you have is to do the TENS or to do box breathing, which is essentially kind of following a pattern of a box. And that helps increase your parasympathetic tone while you're doing it. So essentially, it's 4 seconds inhale, hold 4 seconds, exhale, hold 4 seconds, and then repeat. So this indirectly activates the parasympathetic nervous system. The TENS or the vagus stimulation is really the only way to directly stimulate it. Diane is asking what my percentage recovery rate, and does it differ? And does it differ between anosmia that switched to parosmia versus those who had returned to normal then parosmia? So once you've had parosmia, whether or not you go back to anosmia or normal and kind of switch back and forth, it really acts pretty much like parosmia at that point. So my success rates with parosmia will be about 60 to 70%. And the way I look at successes with parosmia is not necessarily regaining normal smell and taste. With parosmia, my goal is to get you to be able to eat foods that you normally find bad or unable to eat because they smell bad or taste bad. So even if they don't necessarily taste or smell bad, but now are tolerable, that to me is a success. Because the whole point of this is not to lose weight and be able to have as balanced of a diet as you can. Alicia is asking about a percentage rate of success for loss of taste and smell. For me personally, in my clinic, we've seen a very high success rate with anosmia and loss of taste. I believe out of hundreds of patients that we've done just for anosmia, I think we've had 2 that did not get recovery of taste and smell. Everybody else does. And with anosmia, it's kind of funny. It really is like a switch. 1 second you don't taste or smell anything, and within a few minutes after the block, everything comes back. Luke is asking about percentage of rate for anxiety. So if we're talking about stellate ganglion block, it's nearly 100%. I mean, anxiety and depression is something we've been treating with PTSD, with stellate ganglion blocks, way before long COVID was even discussed or known. So it really works well at anxiety because the sympathetic nervous system really drives anxiety. I mean, that's what it's supposed to do. You're fighting or running. I mean, your body thinks you're in danger. It's in danger. That's also why you're having issues with sleep. When your sympathetic nervous system is high, you think your body is going to let you sleep or sleep well. It's just not. So anxiety, depression, insomnia, all these things get better after a stellate ganglion block, and it's fairly high success rate with that. Kayla is asking about Epstein-Barr virus. So Epstein-Barr virus is known as EBV, or it causes mononucleosis, the kissing disease. Kind of every teenager has heard of it or has had it at one point in their lives. So what's interesting about this virus is it's part of the herpes family, and herpes is known to live on. In other words, it stays in nerve tissue, and when your immune system is compromised or decreases, it says, oh, well, it's time to wake up, and it comes back out and causes problems again. Chickenpox is another one. Chickenpox is another virus is also part of the herpes family. It's known as zoster, or herpes zoster, and it can do the same thing. It's a virus that keeps on giving. So the Epstein-Barr virus puts you at risk for developing long COVID, and the reason is because it attacks nerves, and it has a proclivity for the autonomic nervous system. So once it causes a little bit of damage, even if it's repaired, your system is already compromised, and you're more likely to develop long COVID than somebody who has not had Epstein-Barr virus before. And it's fairly common virus. So let's see here. I think I've gotten everybody's question. Let me just make sure. Okay, Kayla is asking if you've had a successful block and hyposmia and parosmia go away, how likely is it to come back? Well, it's a loaded question. It really depends on you and your body. If you are in a constant stressful situation, or you put yourself into stress, there's likelihood that it can come back. If you get sick with something, especially a respiratory virus, it tends to come back. For some people, it comes back, but is very short-lived and then goes away again. The goal here is I guess the main goal here is to get your parasympathetic system active and high, so that your system can heal. It may take a few weeks. So hopefully you won't get sick or stressed out right afterwards, and there's a great chance of not having it to have to come back. Let me see here. Let's see. Diane is asking about costs, logistics. So, I mean, we purposely priced this. I mean, I could definitely price it higher, but we try to make this affordable for everybody. So we priced this for $500 per side, which includes the two levels, which is C6 and C4. And we'll consult with you here if you need that. But that's essentially the cost, $500. Um, um, LNS is asking about any other providers. So here's the thing. I feel very responsible if I, for instance, recommend another physician or another group, and they either do a bad job, or you have a complication or a problem, or it doesn't work. I kind of take that personally, because when I recommend somebody, it means that I actually seen them do the block, um, not just heard about the results, but I want to see them drive the needle, live image review, and basically know that number one, they're hitting the right area, at least several times, and are missing kind of dangerous areas like the brachial plexus, the carotid artery, the vertebral artery, the thyroid. I mean, this block, you can get into a lot of trouble if you're not really, really good with the anatomy. If you mistake, for instance, the posterior tubercle for the anterior tubercle, you could potentially, drive the needle into the spinal cord or into a spinal nerve without even realizing it. So it really requires quite a bit of a skill set to know how to do this block successfully and effectively. So I'd rather not recommend anybody else, again, unless I've seen them do it. And so far, I really haven't traveled anywhere to see. I'm willing to train doctors to do it. But the thing is I really can't recommend anybody because I feel personally responsible without knowing for sure. Diane is also asking if you need to stay overnight. You don't need to stay overnight. There's no long hauler rate or anything. I mean, we have 2 hotels within walking distance of our office. If you wanted to, like within 2 minutes, you can either do both blocks on the same day if you have the first block done in the morning, or you can do the one block on one day and the second side on the other day. Like I said, it's well tolerated. I usually tell most people right after the block to, if they're feeling tired, go ahead and take a nap. Go to the hotel, take a nap. You'll feel much better in about 2 hours. If you have tons of energy, go eat. Go to a local restaurant. We have a ton of really good places to eat here. Go and enjoy, and let me know how it is. And if you need the left side done, just give us a call or come on in. That's basically it. Let me see here. Jane is asking about me publishing my results. I don't really have like written results to publish. I'm not a researcher or an academic, doctor. People in academia, they have access to tons and tons of help, essentially, to record all these details and everything, and to keep meticulous, symptom records and everything. We're a private practice. We have staff, obviously, but our focus is slightly different than somebody in academics. So I really, even if I wanted to publish, publishing in the United States is not so easy. You have to go through an organization called the IRB, which is an ethics type of organization. You have to show them how you're going to do it, what are you recording, what you're going to ask. It's kind of a complicated process, and in order to publish, if you don't publish, they don't care what you do, sort of. But if you want to publish it in the medical journal, then the requirements are very different. So it's not really feasible for us to be able to do a publication. Holly's asking, how long does the procedure take for each side? So each procedure is essentially unique. So it could take anywhere from 5 minutes to 10 minutes to complete the procedure. So kind of the way that I look at it is once I get my ultrasound probe on, I map out the course. So where am I going to enter from the skin? Where do I want to go? Are there obstacles in the way? Sometimes the interior um, interior jugular vein is in the way. Sometimes you have extra vessels that are also in the way of the needle path. So I essentially need to plan where I'm going to go, and sometimes it's a zigzag pattern, how I'm going to get from the skin to the stellate ganglion or the sympathetic tract. So sometimes, like I said, it's very quick, and other times it takes a few minutes to make sure that everything stays safe. Okay. Britta is asking, if you get the SGB and there's no improvement for parosmia, how likely would there be improvement in another SGB? Now, that is a very good question. In the past, I believe that, if you've done one SGB and there's no improvement, chances are you're not going to get any additional improvement or any future improvement if you repeat it. But lately, I've reconsidered that. So again, it depends on who's doing your stellate ganglion block, and I'm assuming you're having it done, with a longer acting local anesthetic like ropivacaine or bupivacaine. My thinking on this is that you're essentially kind of applying a crowbar to the pedal that's stuck. And you can push it down once, you can push it down twice, you can push it down for 30 minutes or 45 minutes or 4 hours or 5 hours. So my thinking is the longer you try to unstick it, the greater the chances that it's going to get actually unstuck. So there is a possibility with repeating a stellate ganglion block that has not worked, that it will actually work the second or third time. That, of course, assumes that you actually got a stellate ganglion block. If you've gotten local shoved into your neck and you haven't developed any of the Horner syndromes, then you didn't really have a stellate ganglion block. Of course, it's not going to work. How can it work if the local anesthetic didn't really go where it was supposed to go? It's not going to work. So, when people tell me their stellate ganglion block didn't work, my first question is, well, did you have a Horner syndrome? Did you have a red eye? Did you have a droopy lid? Did you have a small pupil? Was the nostril on the side blocked, stuffy compared to the other side? Did part of your face or cheek or ear, or arm or shoulder get flushed or red? If you don't have at least 3 signs of a Horner syndrome, it's not really a good stellate ganglion block. And whether it lasts for 30 minutes or 4 hours, the point is, if you didn't develop the Horner syndrome, you didn't have a stellate ganglion block. You just had local put into your neck, and it's sitting there, and that's great. Sometimes it goes around the brachial plexus, and you get a nice brachial plexus block or interscaling block, and it makes the arm numb or weak, or you can't move it for a couple hours. But that's not a stellate ganglion block. So Luke is asking, if you're extremely nervous, can you be sedated? So we had offered sedation in the past for these procedures, but because I'm working around the neck, and sedation is not like a general anesthetic with gas being driven through an endotracheal tube or anything like that. Sometimes people have trouble breathing or cough, and it makes the procedure actually a lot longer and more complicated. So we've really stopped doing sedation for these procedures because of that. And the majority of people tolerate it just fine, as young as 10. We've had who tolerate the procedure awake because we're talking to you through the entire procedure. We're holding your hand, and Everything is going nice and slow and explained. And even the most nervous people that I've done over the last couple of weeks have had absolutely no trouble doing it awake. And the other problem with doing it with sedation or knocking you out is it's more difficult to assess after the procedure. Did you have good results or not? You're kind of out of it, and you don't know if it's because of the sedation or is it because of the block. So, if I have my choice, I prefer not to sedate for this procedure. So Kayla is asking about brain fog and fatigue. And is it similar to hyposmia and parosmia? Kayla, I'm sorry, I don't remember your original question. So if you can please retype it so I know which way you're headed. So Diane is asking about Bell's palsy. Is there any contraindications? I mean, there are some contraindications to a stellate ganglion block. One being on blood thinners, especially if you're on more than one blood thinner, either a platelet inhibitor or an anticoagulant, such as heparin or related compounds. But Bell's palsy is not one of the contraindications. That's a paresis or paralysis of the cranial nerve, the facial cranial nerve, which is number 7, and that won't have any impact on a stellate ganglion block. Holly's asking about medication supplements that you should stop. I mean, ideally, you don't want to be on any anticoagulants, such as Pradaxa, Plavix, or Coumadin. But I'm in no position to tell you to stop those. You really need to talk to the prescriber of the medications to make sure it's safe to stop. So essentially, you don't want to cause more harm by stopping the medication and stroking out or getting a DVT or pulmonary embolism from a leg. So you always want to, since I don't know your full history, you always want to go to the prescriber who started you on those medications and see if it's safe to stop. I guess Mr. Bracken or GD Bracken is asking if the block didn't work, would patients pay again? So what do you mean by block didn't work? So are you talking about not getting a Horner syndrome? In that case, the block wasn't done properly. And in that case, you'd want to repeat it. If that ever happened to me in my office, I would repeat it at no cost. However, as we always state, stellate ganglion block is not guaranteed to remove your anosmia, parosmia, brain fog, fatigue. I mean, how can you? You don't know what kind of effect it's going to have. But at the same time, well, you would essentially, you've performed the procedure, provided my time, provided the equipment and the consumables and paid the staff and everything else. So yes, I mean, if you wanted to repeat it, if you didn't get any results from the block, but it was done properly, yes, you would have to pay again to repeat it. I hope that answers the question. Premier Video is asking about TENS therapy for can it achieve a brownout reset? Yes, you can actually get a full recovery with using a TENS vagus nerve stimulation of the ear. It just takes longer. So instead of kind of a sledgehammer, you're using a very tiny one, and just it's repeated over and over again. So with the TENS unit, it may take up to 30 days. It may take 3 months to get you there. Not everyone is going to respond to the TENS vagus nerve stimulation, just like not everybody's going to respond to the stellate ganglion block. So that's essentially the question there. I hope I answered it. So Kayla is asking if you're recovering from a cold and have lingering sinus pressure and sniffles, will this affect having the block? Well, yes. So you don't want to be currently sick. You don't want to be recovering from something. You want to be at your best. The reason is because your autonomic nervous system is already overtaxed just from being having long COVID. If you also add another illness, it's already increasing your sympathetic drive that much more. It's working your immune system more. So in those cases, it's just better to wait until you fully recovered before attempting a stellate ganglion block. Unfortunately, sometimes you have the stellate ganglion block and then you get sick in a day or two. And that's going to suck, unfortunately. And it can potentially revert you back, basically to ground zero, despite having a stellate ganglion block, because your body hadn't had enough time to recover. That's also why I recommend doing the TENS unit, before the stellate ganglion block, after the stellate ganglion block. Do it for a month. Do it for 2 months. It's going to help your parasympathetic nervous system do what it's meant to do, which is heal you. Your body will not heal if you don't have a good parasympathetic tone. It just won't. It's not going to repair anything. You're going to have a lot of problems if that system is not working the way it's meant to work. Okay, so let's take a look. So Britta is talking about her daughter, both of them actually, her daughter and her, have had a hoarseness syndrome. So I had a successful block. I'm hoping you're talking about at least having 3 symptoms of the hoarseness syndrome that I mentioned. And had 0 improvement. I know it's devastating. It breaks my heart. It really does. I hate it when, we've done a perfectly good stellate ganglion block and it didn't work. But you got to understand this is a treatment. It's not a cure. It's essentially, while it's more involved, it's no different than taking a medication for blood pressure. Why do they have 10 different classes of blood pressure medication? If one medication, let's say like propranolol, works for everybody, you could just give propranolol to everybody. But as you know, it's not going to work for every single person. Some people are going to respond, others won't. Some need an ACE inhibitor. Some need a calcium channel blocker. Some need a water pill or a diuretic in order to lower the blood pressure. It's the same thing here. Unfortunately, there's not a ton of options to offer. So yes, it is devastating. As I said in the past, there is still a chance that it's just such a stuck pedal that doing one stellate ganglion block is not enough. If you had somebody who, for instance, put in lidocaine in and you only had hoarseness for 30 to 45 minutes, that may not be enough. You may need a longer acting stellate ganglion block, like with ropivacaine. But either way, it may be worthwhile to at least consider repeating at least once more and see if you have any improvement with the second time around. Sarah is asking if you're not responding to the TENS unit, doing it daily for 3 months, will the response to the SGB also be lower? They're not really correlated because the TENS unit mainly works on directly stimulating the vagus nerve, which is part of the parasympathetic nervous system, whereas the stellate ganglion block mainly works on the sympathetic side. So while they kind of oppose each other on a seesaw, now response to one won't necessarily impact the other. However, if you been doing your TENS unit for 3 months, I'm hoping that you're trying the right ear as well, and at a lower intensity, of course. But if if you're not getting any response at all, you may want to vary the frequency between 20 and 30 hertz by a couple of points each day, and see if that helps. So maybe do 20 hertz one day, the next day do 25, the next day do 29, the next day do 21. So just vary it around and see if maybe your vagus nerve has gotten used to the 25 hertz and it's not being stimulated anymore. So it kind of ignores it, becomes refractory. Despite you stimulating it, it sort of says, well, I know what this is. I don't want to do this anymore. So by varying it by a little bit each day, it may make a difference. So that's one thing you can try. So Hope and Jason are asking about the heart rate. Does a high heart rate mean that your nervous system is stuck? So many times, long COVID and dysautonomia, we do see a high heart rate, but it's not always the case. So an easier way to tell if your sympathetic nervous system is stuck is to look at HRV, which is heart rate variability, and that's from beat to beat changes in milliseconds. And what we're looking for there is there's a high variability or a low variability. And if it's low variability, chances are your sympathetic nervous system is stuck in overdrive. And if you have a high heart rate variability, there's a good chance that it's not. Tony is asking about success rates with relief from head pressure pain from long COVID. So I'm not really sure what you mean by head pressure. Are we talking about like headaches? I've heard people have increased incidence of migraines after while suffering from long COVID, or are we talking about sinus pressure? Basically in the front, top, or a type. And oftentimes, especially with sinus, even though it feels like sinus, when CAT scan is done of the face, there's not a whole lot of anything found on CAT scans. So we've seen a few patients with this, but not enough yet to draw any conclusions regarding the stellate ganglion block ability to treat this. This may be neurological. It may be essentially a nerve confusion with kind of what's going on in the face, similar to smell and taste, except it presents itself as pressure instead of an abnormal taste or smell or loss of taste or smell. Okay. So Kayla, I'm not gonna answer that question on the air about you're feeling sick and coming in, but feel free to reach out on private message or give us a call, and I'll be happy to tell you that. So Matt is asking about Theophylline for hyposmia. So that's one of the doctors that I reached out. That's what he recommends. He's an ENT doctor, and that the study that he's done that was published in JAMA, I believe I included a link to it on Facebook. That study precedes long COVID or COVID. So there were, I know it's hard to believe, but parosmia, anosmia, and hyposmia existed prior to long COVID. It just wasn't as prevalent. For instance, certain neurologic conditions used to cause these kind of problems. And one of them was Parkinson's. Alzheimer's can do it as well. Sometimes traumatic brain injury can do that. But I believe that the cause or the mechanism may be slightly different. I don't have a problem prescribing nasal or intranasal theophylline. I wouldn't do oral. I think oral carries too much risk with side effects. But if anyone wants to try um, intranasal theophylline for hyposmia, I'm willing to prescribe it. So um, essentially, it has to be compounded, though. It's not available commercially. So it has to go through a compound pharmacy to basically create a nasal spray out of an oral theophylline. Alicia is asking if the SGB hurt. It probably hurts less than getting stuck for a blood draw. It's basically a small pinch with a tiny, tiny needle to numb up the skin where the main needle is going to enter. Like I said, most people handle it awake without any problems. But again, it really depends on your operator and who's actually performing the procedure. We have extra people available in the procedure room to help relax you and talk to you while I perform the procedure. Kids as young as 10 years old were able to do it awake. I've done plenty of 10, 11 to 15-year-olds, and no one really had any problems. Yes, they were nervous at first, but we kind of talk to them and relax them, and we have music playing in our procedure room, and before you know it, it's over. And sometimes they'll ask me, when are you going to start? And I'm already done. So it's not really that uncomfortable for the majority of people. You just have to, like I said, it's really not a painful procedure. Holly is asking, after the first Iodine, how long do you need to monitor us? So before we let you leave, number one, I'm going to visit with you several times. Immediately after the procedure and then a few times after. Number one, I'm going to be looking for Horner syndrome, and I'll tell you what I'm seeing, and I'll ask you questions about your symptoms and how you feel. If you're coming in for smell or taste, we will smell and taste you, taste test you to see if if you smell or taste any differences, if anything is improved. I'm also going to be watching your vital signs. So heart rate and blood pressure are checked several times. So it's very, very common especially after the left side, to have higher blood pressure. It's not dangerously high, but it's going to be higher than what you normally are used to or what you normally run at. And that may be the compensatory response from the other side. Sometimes if you check it on one side, it'll be much higher than the other arm, for instance. So typically we don't keep people here more than 30 minutes. Sometimes it's a little less. It really depends on how you feel. Some people feel dizzy afterwards for a little while. You've shifted your blood flow in your brain. So your body got used to whatever flow it had for the last several months or even years, and all of a sudden you make a change. It's gonna be you're gonna feel dizzy because all of a sudden things are different than what they were a few minutes ago. So that's usually transient and should resolve within a few minutes. Some people have continued dizziness for other reasons, usually medications that now are kind of working more than they should be because you were taking those medications to help with long COVID. And the long COVID is, the symptoms have been abated, but you're still taking those same medications and having the effects of those medications. I hope that that helps answer your question. Alicia is asking about doing both procedures on the same day. I'm assuming she means both sides on the same day. Yes, I can do both sides on the same day. I'm comfortable doing both sides on the same day. That assumes that the first procedure, which is the right side, we do in the morning. And then the second side we do in the afternoon. So the only question I'm going to ask you is did the throat symptoms, did they go away? So did the lump in the throat, did the loss of voice, did the hoarseness, did that go away? Because that's really the main thing we worry about with blocking the second side before the first side had a chance to wear off. Luke is asking about tinnitus. The tinnitus, excuse me one second. Does tinnitus go away with the stellate ganglion block? I don't typically do a stellate ganglion block to treat tinnitus, but people who coincidentally had tinnitus did seem to get better after the stellate ganglion block. I do think the TENS unit, vagus nerve stimulation, works well for tinnitus as well. So let's see here. I'm just making sure that I didn't miss any questions. So this will be my last question from Alicia. Would it be better to do one side and then come back the next day? So it's really personal preference. I don't think one or the other changes the outcome of the results. So some people fly in the morning, have their blocks done, one in the morning, one in the afternoon, and then fly out that day. Some people come in the night before and have their block done and have the other block done in the afternoon and then leave. Other people will have one block one day and one the next. It kind of depends on the comfort level of your physician or provider that's doing the block. As you saw, some practices don't want to do anything within 2 weeks of each other. But in essence, there's no harm in it. Like I said, as long as you're able to discern basically the recovery of the recurrent laryngeal nerve or the throat issues. By the way, the throat issues are not really part of the Horner syndrome or part of the stellate ganglion block. It's just because you're doing the block at C6, and that is very close to where the recurrent laryngeal nerve basically enters your voice box. And in essence, when you put medication there, a little bit will spread to that nerve and will numb it almost 100% of the time. So we're not really aiming to block that, and that has no indication that you had a good stellate ganglion block or not, because you can technically put local in the neck and block that nerve, because it's very, very small, and it just needs 1 or 2 milliliters of local anesthetic to make it numb. And but that has nothing to do, no bearing on whether you have a good stellate ganglion block or not. The only thing you can know for sure if you've had it is if you've had several symptoms from the Horners. So that's why I like to use at least 3, because using one, well, you may have gotten a few milliliters over the stellate ganglion block, but not enough to really cause a good one. And to me, that's not really a good stellate ganglion block. So, essentially, The throat thing is what people usually complain about or know. They know about the droopy eye, but I look at all of the Horner syndrome and I count all of them. But the throat thing is more annoying than anything else. So if you get it, it's not particularly comfortable, but it's not too bad either. If you don't get it, it doesn't again mean that you had a bad stellate ganglion block or not. So we don't really pay attention to whether you get it or not, except as a side effect that when you're doing the other side, you want to make sure the throat part is resolved. Okay, well, thank you very much. It's been a pleasure. I hope everybody got their questions answered, and I'll be doing this again in a month, sometime in January. Okay? I was kind of hoping that somebody was going to ask about peptides or about some of the other treatment options that I discussed in the Facebook group, but I guess we can wait until next month. That'd be great. Thank you.